Aspirin is more than just a painkiller. It has hidden benefits that might change and improve your life, but it's not for everyone. In this video, I'll discuss the top 5 hidden benefits of aspirin and its worst side effects, and you can decide whether you need to take it or not.
Hidden benefit number 1. It helps prevent colon cancer.
This one shocked me. I was surprised. Doctors have long been recommending aspirin for heart health, but recent studies suggest that it might actually lower the risk of certain cancers, especially that one that's really cropping up among young people, colon cancer. But how does a simple painkiller do something like that, prevent cancers? Well, it turns out aspirin has anti-inflammatory properties that can stop the growth of cancerous cells before they become deadly. Evidence suggests that low-dose aspirin, starting at 50 milligrams per day, can be as effective as a prevention as colonoscopy screening. Now, that may amaze you, and you may not have heard of 50 milligrams. If you're here in the U.S., you may have a problem finding that. In the U.S., the standard baby aspirin dosage is 80, and that will be just fine. In fact, the best results were actually found at larger doses as high as 500 milligrams, again, to prevent colon cancer. Although considering the side effects of aspirin, the jury's still out if the juice is worth the squeeze on this one. That's not humor. That's an analogy that helps people understand risk-benefit. But
hidden benefit number 2. It can help prevent pregnancy complications.
This one might sound crazy, but doctors are actually prescribing aspirin to some pregnant women to help prevent serious complications. Wait, isn't aspirin supposed to be avoided during pregnancy? Well, not always. In some cases, low-dose aspirin can actually save the mother and the fetus's life. Studies show that aspirin can reduce the risk of preeclampsia, a dangerous condition that can cause high blood pressure, organ damage, premature birth, and even death. Doctors now recommend low-dose aspirin for women at high risk of preeclampsia, and research shows it can lower the risk by up to 50%.
Hidden benefit number 3. Reducing cardiovascular risk in individuals with elevated Lp(a).
Cholesterol goes beyond just good and bad cholesterol. There's a specific cholesterol transported on a special protein called lipoprotein a, or Lp(a). This lesser-known lipid is a fat or oil is associated with higher risk of heart disease. The next one you may have heard of, but probably not in relation to aspirin. You remember Bob Harper, that trainer on The Biggest Loser? He was in his early 50s. He was doing a workout one Sunday morning and had a heart attack. He was in great shape. He told us later on he had Lp(a), and he had inherited that from his mom. What's that got to do with aspirin? Well, it appears that baby aspirin can help prevent cardiovascular risk associated with Lp(a). So how does aspirin come into the picture with this sneaky heart risk factor, Lp(a)? Recent studies reveal that aspirin may help reduce cardiovascular events in individuals with elevated Lp(a). Aspirin's antiplatelet. It's like it decreases platelet activity, which decreases clotting, and that counteracts the clotting increase associated with Lp(a). One study found that individuals with high Lp(a) took aspirin and significantly lowered their risk and incidence of cardiovascular events compared to those who did not. This study suggests that aspirin could be a simple yet effective strategy for managing that specific heart disease risk. So think about it. If you got Lp(a), remember this: baby aspirin. Looks like aspirin isn't just good for your headaches. It might also keep your ticker ticking. Who knew this old dog had so many new tricks? Hidden benefit number 4. Could help fight deadly sepsis. Sepsis is one of the deadliest medical conditions or emergencies, killing millions of people every year. But what if aspirin could actually help save the lives of people with sepsis? It appears that it could. Doctors are now discovering that aspirin may reduce the risk of severe sepsis, a condition where the body's response to an infection spirals out of control, causing even organ failure and death. Sepsis is often worsened by blood clots and excessive inflammation. two things aspirin's really good at controlling. Studies suggest that aspirin could lower the risk of death from sepsis by preventing that clotting and reducing the dangerous inflammation in the body, and especially heart damage caused by sepsis. One study found that patients who were already taking aspirin had a lower risk of dying from sepsis-related complications. While it's not a cure, it could be a game-changing tool in preventing sepsis from becoming fatal. So aspirin might help stop one of the deadliest infections. Talk about an overachiever. The next thing you know, it might be fixing Wi-Fi problems, too. That was awful. Sorry about that.
Hidden benefit number 5. It may reduce the risk of skin cancer.
Most of us rely on sunscreen to protect against skin cancers, or a lot of people do. But what if this common over-the-counter pill could offer additional protection, or protection if you don't want to take sunscreen? A meta-analysis. Remember that? If you don't know, a meta-analysis is a study of all the studies in a certain question. This was a meta-analysis looking at all the studies associated with can aspirin prevent skin cancer. This meta-analysis found that regular aspirin use was associated with a significant decrease in the incidence of squamous cell cancer. Squamous cell is a common type and it can be dangerous. While more research is needed to fully understand this relationship, these findings open up exciting possibilities for aspirin as a preventive measure against skin cancer.
So, we've talked about a lot of roles of aspirin, but many people would say we might have left out the most important. There's a life-saving role for aspirin. So imagine this. You're sitting in your living room. You start to develop a little bit of chest pain. And it's maybe over here, maybe comes down the left arm a little bit. You might have a little problem breathing. You might not. You need to be thinking, I might be having a heart attack. You might be feeling a little bit of shortness of breath. You might break out into a cold sweat. You might even start feeling something going up into the jaw. At this point, you got to say to yourself, I'm having a heart attack until it's totally proven otherwise. You need to get in for acute care, emergency care. This is an emergency. So what may be happening is you may have formed a clot. That clot may have gone to the arteries in your heart. It may be plugging up one of those arteries. This is a life or death event. Now, as I said, this is a life-threatening event until proven otherwise. Assume you've got a heart attack. Call 911. And then next, here's where the aspirin comes in. Take an aspirin. And at this point, we're not talking about baby aspirin. We're not talking about 50 milligrams. We're not talking about 80 milligrams. We're talking about 325, 360, something like that. If all you have, that's a regular aspirin, by the way, and if all you have is just a baby aspirin, take 4 of them. 4 times 80, 320 milligrams. And here's a key point. If you can remember it, chew the aspirin. Why? Because we want that aspirin to get to your bloodstream immediately. We don't want it to go down to your stomach and you have to wait for your stomach to digest it. Chew it. Goes straight to the bloodstream. Now, my friend Jesus would say, hey, be careful if it's coated, because that enteric coating can be hard to chew and be serious on your teeth. From my perspective, I'm not quite so worried about your teeth at that point in time. I'd say chew it, get it into your bloodstream. Now, what does aspirin do? It keeps you from forming more clots, and it may even help you dissolve the clot that's causing the problem.
But before you start taking aspirin every day, there's some major risks you need to know about. For some people, aspirin can actually cause serious issues like stomach ulcers, internal bleeding, even hemorrhagic strokes or strokes, bleeding type of strokes, bleeds in the brain. There's also allergies to aspirin. Some people have very severe allergies to aspirin, and this can be a big problem. Doctors recommend taking aspirin daily only if you have a high risk of heart disease or if your doctor specifically prescribes it. So before adding aspirin to your routine, talk to your doctor, because while aspirin is powerful, it's not totally risk-free. Additionally, just in case I haven't said it, there is no medication, including aspirin, that beats a healthy lifestyle. You cannot out-supplement, out-prescribe, out-doctor a lifestyle.
Now, stroke is different. If you have drooping on a side of your face, or if you suddenly get very confused, if you're worried about a stroke, don't take an aspirin. Here's why. This is actually something that people have seen. The story has happened over and over. The husband and wife are sitting in the living room watching TV. All of a sudden, the husband's not able to talk or is talking gibberish, or the face droops. And sometimes you've seen it on some YouTubes when somebody has a stroke while they're on camera. Suddenly, the wife looks at the husband and says, "Wait a minute. I thought you were kidding around with me. What's going on with your face?" And half of the face is drooping. You try to get up out of the chair. You can't. Your body's just not working right. This is very confusing. Just like in the other episode where it was a heart attack until proven otherwise, now you've got a stroke until proven otherwise. And you can't prove that at home. You got to get to the hospital. So here's why it's different, the aspirin story. 87% of strokes are caused by a clot. But the other 13% are not caused by a clot, they're caused by bleeding. We call it a hemorrhagic stroke. So there's no way to tell whether it's a hemorrhagic stroke or a clot-based stroke outside of the hospital. When they ask you to don't take aspirin before a surgical procedure, this is why. Aspirin can cause more bleeding. So you don't want to take aspirin if you have the potential for a bleeding or hemorrhagic stroke. So that's the bottom line. That's why we say don't use an aspirin during a stroke, but do use an aspirin if you're having chest pain and maybe a heart attack. I created the video that you just watched because I have a passion about educating and empowering people like you to take charge of your health. It's the same reason why I created our metabolic risk assessment. This at-home assessment kit contains everything you need to work with one of our coaches to understand the details. It gives you a comprehensive picture and details of your metabolic health status. Using this information and the report that we develop, you'll spend an hour with one of our health coaches to understand your own unique metabolic needs and strengths. Now, all of this equipment is high quality. It's not throwaway stuff. You'll continue to use this for assessments and training during your metabolic health journey. And here's all the information that your coach will review with you from the report. Retail labs and online services charge over $500 for this. And here's the other thing. Those other tests don't even include the most important components, like the oral glucose tolerance test or the grip test. My at-home metabolic risk kit only costs $169.50. Yes, that's right, $169.50, less than $200. If you want to help a family member or friend, you can get an additional box. It's just $119.99. Our goal is to train and help 500 people just this month. We're well on our way. Let's hope one of those is you. Use the link below to start your metabolic health journey now.
This tiny pill has huge potential, but it's not for everyone. Take a look at how I use aspirin to unclog arteries right here.